there is a planned care centre, does this mean that's where all planned care will happen?
Well, I think for most of us as lay people, planned care tends to include things like our outpatient appointments and x-rays and scans. And actually in the Future Fit proposals, both hospitals will continue to provide outpatient clinics, x-rays, diagnostics. They'll continue to provide the kind of regular procedures or injections that might take place in an outpatient setting. What does take place at the planned care site is generally things like day case operations, day case procedures such as endoscopy, and also overnight planned operations as well. So planned operations where we need an overnight stay. So a lot of our planned care would actually be at both sites, but the planned care centre is where generally the main planned operations would take place. There are a number of exceptions to that, and one example would be that actually if we were having a much more complex planned operation, for example one where there's a risk that we might need to go into a high dependency unit or intensive care unit, then actually that planned operation will be at the emergency site, because the emergency site is where the main intensive care and high dependency units will be for the hospital trust. So some of the planned operations will therefore be at that emergency care site.